Okay, what I also failed to mention is that we have 250 people who are joining us by web, because I was concerned about these empty seats, that with all this great learning, that I just think the room should be packed. And I think maybe what we could do is make sure that we spread the word when we leave here, because this is really some rich dialogue. So I know that all of you are likely familiar with who we are at PolicyLink, and what I'm going to be talking about is the role that PolicyLink has been playing in generating and being part of a movement around equity. So when we talk about these movements, the application of which is dear to our heart, is all steeped in the mission of what we're doing and all of the work that we do at PolicyLink. And I'll just begin by framing for those of you, first of all, how many of you have ever been to a PolicyLink Equity Summit? Oh, well, that's good. That's good. So we began doing equity summits. We've had 4 since the inception. And PolicyLink is 14 years old. And the first one was actually in Los Angeles, the very first one in Los Angeles, and it was held at the Mercado de Paloma. We were so excited about the idea. We had 600 people. We felt like we had really arrived on the scene, and it was really an amazing event. And so what we do with these summits is that we bring people together to have dialogue, to stimulate discussion, to share research, to talk about data, to talk about strategies, to lift up what works. That's our tagline. And we really not only look to the traditional people who come, but we really seek funding to bring grassroots groups and to bring them and their alliances together so they can work together on these issues. And so we began with 600 in Los Angeles. We then went to Philadelphia. We went to New Orleans right after Katrina, and our last one was in Detroit. So if you look at the places, we carefully choose where we go. We've never had one in Washington, D.C. We don't plan to. We plan to take them to the places that could benefit from that economic investment that when we bring, so the last one was 2,000 people. Began with 600, 2,000, and we bring it to build infrastructure so that we're trying to walk our talk. So when we bring people together and we have these dialogues, we have these discussions, what we were able to do at the last one was to continue to dialogue through an equity blog and equity network so that we can continue. When you go to these places and you get stimulated and you go back and you don't do anything differently or you don't figure out how to apply it. So we've been very eager to make sure that when we do these summits, that we're bringing together leaders, organizers, grassroots groups, foundation representatives, and others who are interested in this issue of equity. And so how do we make sure that we continue that dialogue? We're planning the next one right now, and I can't tell you where it's going to be located. It's all going to be kind of secretive. But stay tuned for the next Equity Summit. That's the place where we go and really have these discussions. And so what I want to talk now about is the health equity piece, which is the one that's dear to my heart. We don't just do health equity at PolicyLink. We do a lot of work around equity. I lead the health work, but we also have someone working with us around infrastructure equity, looking at how we need to make changes in the built environment to have more equitable places to live. We're doing work around equity around boys and men of color, because there's major inequities in how men are not being served, and they're in this cradle to prison pipeline, and we're trying to change that. We do equity around a number of issues, and one of the biggest areas that we've been doing work around is around healthy food access. So I want to just spend a moment talking about what that work has been. So, and it's a model for how we do much of our work. So PolicyLink heard a number of years ago about this great work happening in Philadelphia with the Fresh Food Financing Initiative. And this was an initiative that was really looking at the fact that grocery stores were leaving the inner city Philadelphia, and it was creating what was being called food deserts. And so there was an initiative to bring together public and private financing to create more opportunities to have healthy food and to create grocery stores in these communities. It was such a wonderful model, and it was a model for a number of things. It did not begin with a health initiative. It began as an economic development initiative. It also had workforce because it was hiring people, and it also clearly had health benefits. So we're looking for those kind of models. We were able to, in partnership with the Food Trust and a reinvestment organization, to really bring this model to the Obama administration and figure out how to take it to scale. And from that, we now have a national healthy food financing initiative where there's money in the Obama administration that would go beyond these particular individuals at one particular place. And we now have money where cities can have access to this to get grocery stores, farmers markets, convert neighborhood stores, all that need to be done to create healthy food. And again, we didn't single-handedly do it, we do all of our work in partnerships. And so that's one of the keys in all of this work around movement building. You can have an idea, but you've got to have people working with you to have different levels of outreach and engagement. So that was just one example. We also, there was a similar model to what we did with the Harlem Children's Zone. People may have heard of the New York City Harlem Children's Zone with Jeff Canada, where he's been able to look at 100 blocks in Harlem to really make an initiative to make sure that those children had a career pathway to college. That now is the National Promise Neighborhood Initiative. So we have those grants that are available throughout the country. So these are just two examples of how you can take an idea to scale, and it begins to be a part of a movement. Each one of them alone is not a movement, but it's about how do we generate the interest and how do we make it relevant for what we're attempting to do. So in addition to the Healthy Food Financing Initiative, we also have, as part of the movement around health equity and healthy food, we've been in major partnerships with the California Endowment over a number of years, and they have been active partners with us. We as TA providers, sometimes providing thought leadership, doing whatever needs to be done. When we first started out, we were helping them to do mapping, to figure out where they should put their investments based on where the need was greatest. Everything isn't going to be equal. You don't need to put equal money in equal places. You need to place the money where the investment is best needed. And then we began to work with them around their Healthy Eating Active Communities initiative that was around improving healthy food as well as improving the built environment. And that involved a tremendous amount of creativity, getting, again, grassroots organizations, community-based organizations, government organizations, all working together, looking at the food and changing the food environment, looking at school meals, looking at what happens in neighborhoods, looking at what happens in the healthcare institutions. All of those were things that needed to be explored and figure out, is this environment creating opportunities for health, or is it placing our people more at risk? And how do we begin to shift that mindset? And so one of the things that we've had to do is to realize that although we're interested, I was really interested in hearing Marsha talk about the moral imperative, but when the moral imperative doesn't work, you got to look at the economic imperative. And so you got to use whatever it takes in order to make a movement relevant for people. You can't leave people out. And one of the other things that's really important is this idea of framing. How do we talk about these issues? What is the language that we're using? Is the language going to be engaging, or is it going to be language that people can see themselves as being a part of? And that leads me to the final comment that I want to make in terms of how we're doing this work now. And we're doing a lot of work in highlighting how the country is having a major demographic shift. And anybody who's heard Angela Glover-Blackwell, our CEO, talk, this has been her mantra. And it's a mantra because we need to increase awareness about how this country called the United States of America is shifting. And we've been doing work around America's Tomorrow. And usually if I'm here, I would be doing slides, but I decided today I didn't really want to do slides. I wanted to just have a conversation with you. Because if I had the slides, I would show you how from 2000 to what's being projected to 2040, this country will no longer be where minorities are considered minorities. In fact, we don't even use that term minorities because we are not minorities, certainly in California. There are 4 states that are already majority people of color, and that is California, New Mexico, Texas, and Hawaii. And right now, 46% of all children under the age of 18 are children of color. And so this awareness, we're not doing this work to just say, you know, what do we do about this? Isn't this nice that we're becoming a diverse place? But we have to explore, are we prepared for that shift? What are we doing? How do we mobilize for action? How are we making changes in our policies and our practices and our research? This is all a part of building the movement to prepare for America's future. Now, interestingly, And again, another partnership that we have with the Center for American Progress, we wrote a book called All in Nation, and I would encourage you to go to our website, www.polythink.org, to all of the material that we do. We do major strategic communications, which is why you've got I've got a whole array of materials right here. We've got to be able to make the message compelling. You sometimes have got to use the slick and glossy. You've got to figure out why does it matter to me? So when we did that report and we showed how this country is changing, we wanted to know, how does America feel about this? You know, are they concerned? And interestingly enough, despite what we hear in the media and what we hear from pundits, most Americans are not afraid of this demographic shift. When we did the survey, the majority of people welcomed the idea of us having a shifting environment. So they had three concerns. The ones who did have concerns, they had three legitimate concerns. Number one, what does this mean for jobs? Are they going to come and take my job away? What does it mean for government responsibility? Are we going to have to spend more money for other people? But what I thought was most interesting was, what does it mean for our America? As we start to become more of a community of people of color and more diverse, my identity as an American is this need to shift to some degree. So as long as we have conversations about those things, as long as we talk about them openly, it continues to build the sense that we're all in this together. The whole goal is to make sure that people see themselves as being a part of this work. That's part of movement building, to create access, inclusion, and opportunity. And so what I want to leave you with is the idea that the ingredients for how we do our work, it always involves partnerships. It's about building capacity. It's about looking for opportunities for growth, because really inequality is not good for our economic growth. If we're not paying attention to the fact that the majority of these children are people of color and they're failing in academics, they're failing in terms of some of the health indicators, then what is it going to mean for our America tomorrow? So by raising some of these tough issues, it's not that we're shining a light on the problems, it's that we've got to at least understand where we stand so that we can build the movement together for a healthier environment. There is urgency in this work, and it does require a movement, and we have to each figure out what our role is in shaping this new tomorrow. Thank you very much.
Thank you very much, Mildred. And I just want to note for our speakers, there is a timer up here. You get a 2-minute yellow warning and then a red when your time is up. Michelle Larkin is our next speaker, and she's the Assistant Vice President of the Health Group at the Robert Wood Johnson Foundation. She's also a member on the Roundtable on Population Health Improvement.